things. I mean, it is deeply frustrating that we have no information in front of us. Clearly you know the position of at least some of us around the table, but I mean, I'm just aware that since the independent review and since Jeremy Hunt made the pronouncements about the shape of services on that site, a considerable amount of effort via Health Watch, via other interested parties, has gone in with ideas. You've been consulting people, but we have no outputs, and I think that's very frustrating in terms of democratic accountability. It's frustrating, I think, for us as an adult social care department, because we would like to partner with you. We've partnered, obviously, and done all we can to get to the Better Care Fund proposals, so we understand that, but we do not understand, and we are not party to any of these discussions about what's going on, particularly on the Charing Cross site. So that's my preamble, that it isn't partnership, it's not democratic, and we don't feel we're moving anywhere. What I would like to know is, you described the timetable about submitting the bid. Surely there has been some slippage on that. And what is the implication of the CQC report for Imperial not being able to proceed at least for a year with foundation trust status until you're re-inspected? How can public money possibly be sought when we don't have the assurance of good enough, externally validated services for investment up to 2021 implementation? It just doesn't stack up.
So I can completely understand your frustration, and I can completely understand the frustration of those patients and residents that have contributed their opinions and their co-design to some of the elements, particularly in the local hospital. The situation that we face is that the CCG, as an organisation, cannot raise capital. It is not one of its functions to itself to raise capital. Therefore, to a certain extent, we have to hand over the contributions and the plans that have been made to the organisations within the NHS who can amongst themselves raise capital, and that is why the implementation business case is in effect going to NHS England and has to then go through that process. In terms of the adult social care, I believe that we are working well together and have made very good decisions with the Better Care Fund, and I think that will play very well into the local hospital as it develops, because the community independence service that forms part of the Better Care Fund actually is an integral part of the way that we will help to work with local residents in order for them to be able to be independent at home.
I don't know, would you want to take the FT point?
I'll just add a bit of extra tracing about what's coming up on that as well. So, in terms of has the implementation business case slipped slightly, it has done. It has been a complex task to bring them all together. And it's obviously very important that we reconcile different business cases that have been produced by different people to make sure that we are have got a complete picture of activity and we haven't missed anything or duplicated. So that has taken longer than originally anticipated, but we are getting closer to that now. As I say, I'm sure Tracy will want to come in on the FT point, but I think it's important to remember that there are elements of the estate in some areas and in some of the other hospitals that need to be addressed. And part of the purpose of the implementation business case is to seek the capital that will enable the trust to do that, to make the improvements that will help to improve care for their patients.
In terms of the FT process, you're quite right, we need a good or an outstanding rating from the CQC to progress in that FT pipeline, assuming there is still an FT pipeline after the next election. And there is, I think, some lack of clarity about what that pathway may be going forward, but if the pathway stays the same, then we would need a good or outstanding to continue on that FT journey, and it would be about another 12 months then from there. So listening to what Professor Baker said, he thought the inspection across our trust would be in about 12 months' time, and assuming a good or outstanding rating, then it would be about 12 months after that to complete the FT journey. There is a step that perhaps is just worth highlighting in terms of the IMBC. Once there has been a decision on that IMBC, each of the trusts still needs to go away and then do a final business case, which is really getting down to the very detailed level of planning across each of the sites that then needs to get approval to then be allocated the capital. So the development of a final business case does take a trust approximately 12 months to complete, and then you would expect another probably 6 months after that to get a decision and to be in receipt of the capital. So depending on when we hear back from NHS England and the Department of Health in relation to the IMBC, it's 12 months from there for the trust to do its final business case, and probably another 6 months after that to get a decision. Once we get that capital, then the capital program can roll itself through, and for our capital program it's about a 3 to 4 year timescale to do all the redevelopments in that outline business case and in line with our clinical strategy. So your question, I think, was about the trust borrowing money at the time where it's still got to require the improvement. That will be many months after having had a re-inspection that we would be in a position to borrow the money to actually do the capital redevelopments.